This is Aaron Martin. I'm the Executive Vice President and Chief Digital Officer for Providence, and I'll walk you through the Providence digital platform. There's kind of four main components of it. The first is the uniform digital platform. So these are big platforms that we pulled together and united, or we've made consistent across the organization, or we're in the process of doing that. We made investments to create a uniform digital platform around brand. For instance, brand is really important because if you have a disorganized brand that is fragmented offline, it's 10 times worse online because brand has either a multiplier or a subtraction effect online if your brand is not strong. And so we've made huge investments in brand, and you can see that in our Southern California region where we've converted several different legacy brands into the Providence brand. The second thing we've done in alignment with brand is we rolled out a consistent website that we call One Site. When I first joined, we had 56, websites, I think, across the health system. In some cases, we had a website for every single hospital that we had in Southern California. This creates, again, a fragmented experience that the patient has a hard time navigating across, and it also means that we're competing against ourselves online. Third area is the app. And so we built the Providence app, which contains our Epic MyChart experience, but many, many other different experiences, including the ability to engage with our smart assistant, Grace, the ability to book a same-day care appointment through DexCare, et cetera. We've also built a consumer data platform that allows us to really understand on a 360 basis, how our patients are engaging, not only just from kind of their clinical data, but also how are they, where are they engaging on the website or the apps, and how can we learn more about them to create better and more personalized experiences from a single data source. And then finally, identity. We've recently just rolled out single sign-on, and that gives us a huge advantage in terms of patients being able to have a frictionless experience between the different digital platforms that they work on. They can have a single identity across all of our digital platforms. Second is the digitized endpoints that we've built. So these are areas where every service that the organization provides to its patients, to its consumers, should have a digital endpoint, a digital option for someone to engage with. And so we obviously haven't completed this part of the journey, but what we ultimately want to have happen is you could schedule, you can do an asynchronous, for instance, messaging with a care provider, you could do a video visit, or you can integrate to an API for every single one of the services that we provide. Right now, we're very focused, obviously, on same-day scheduling, primary care scheduling, and we'll be eventually rolling out specialty scheduling. But you can imagine things like, setting up, for, test results, ordering pharmaceuticals from our pharmacies, those types of use cases, getting an MRI done, all should have a digital option to be self-serviceable to the patient. And then finally, navigating and engaging with the patient. So how do we, after you've kind of come through one of these platforms, you've found us through, the digital part, through a digital self-service component, you've booked with us online, or you've done a video visit, how do we keep you engaged around your health between episodes of care and create a relationship with you? And it comes down to the consumer engagement platform, which powers the Providence app. And what that allows us to do is create personalized experiences so that your app is not like anybody else's Providence app across as a patient. It provides you a personalized experience based on your needs, and then also based on your interests around health. Secondly, we built a smart assistant called Grace that helps you do various different things, complete kind of tasks from a self-service standpoint. Grace will help you, reset your password, help you find a location that you want to kind of, get to, one of our care locations, et cetera. And then she'll also do differential diagnosis and kind of tell you, based on, the symptoms that you're exhibiting, which care venue is most appropriate for you. And then finally, over time, we hope that she will kind of help navigate you between episodes of care to kind of pull together all the different kind of components of what you need to be ready, for instance, for a physician visit, for a procedure, and then kind of pulls together everything into a coherent whole both before and after the episode of care. And then finally, OneSight is another navigation platform that I already mentioned that basically allows the patient to easily find using the internet a whole host of different services that we provide and navigate you to the right and appropriate one. And then finally, if we do these three things well, we have a uniform digital platform, we digitize the endpoints, and we create a good navigation and engagement experience. This enables brand new business models that weren't possible before in healthcare because we have these new digital capabilities. In partnership with the ACN team, they have launched a business called Express Care, which allows online retail as well as offline retail access to healthcare, very quick and easy and convenient. And honestly, we couldn't do a lot of the things that you needed to have done through just phone support, for instance. It allows you to kind of do same-day booking and then also do online video visits, which became very, very important to us during COVID when we needed to use that platform to help patients be seen safely, if they were suspected of having COVID in the early days before we had access to PPE on a widespread basis. So I hope that gives you a kind of a sense as to, a little bit about the health system, a little bit about our development program and how we kind of innovate and what our process is, and then also the digital platform.